Let's jump right into this explainer. We're looking at a deeply complex issue today where public health and the justice system essentially collide. We're talking about New York's correctional health care. Providing medical care behind bars is universally considered one of the toughest jobs in the entire justice system. And in New York, well, it's a massive, incredibly diverse landscape. You've got local, county jails, huge New York City facilities, all the way up to state prisons. So we're going to unpack the latest data and 2026 reports to see exactly what's going on inside this system right now.
Here's how we're going to break down this massive statewide issue today. First, a system under pressure. Second, acute needs behind bars. Third, the healthcare workforce crisis. Fourth, the price of failed oversight. Fifth, the aging prison population. And finally, building a better system.
Okay, kicking things off with Section 1, a system under pressure, focusing on the core financial paradox.
So, look at this. We are facing a massive paradox in 2026. The overall incarcerated population in New York is actually going down, but on the flip side, healthcare costs are absolutely skyrocketing. Honestly, it defies basic logic at first glance, right? But it starts making sense when you realize that the folks still in custody have incredibly complex, layered needs. These are conditions that demand way more resources per person than we've historically seen.
Just to put a hard number on that paradox. Wow. According to the State Comptroller's 2026 report, the Department of Corrections and Community Supervision saw their healthcare spending hit a staggering $450.6 million, and that's just in a single fiscal year. Plus, keep in mind, this isn't exclusively a state prison issue. County and city systems are feeling this exact same budget squeeze, meaning local tax dollars are working overtime to cover these escalating medical bills.
Moving on to Section 2, acute needs behind bars, specifically looking at triage at intake.
State health agencies are really pushing for a massive shift in how we view this. Justice-involved healthcare is not just a criminal justice problem, it's a critical population health issue. Think about it. When people enter the jail system, they very often arrive with serious, completely untreated health conditions. The second they cross that threshold, managing those severe disparities becomes the facility's immediate responsibility. And remember, almost all of these individuals are eventually returning to the community, so their health outcomes really are everyone's concern.
Just imagine the absolute onslaught of medical needs the second those intake doors close. Facilities get hit with everything, all at once. We're talking critical detoxification, rapid medication management, and triaging acute psychiatric crises where folks might be actively suicidal or psychotic. Especially in local jails, these intense needs are squeezed into super short stays. That makes rapid triage literally a matter of life and death. If they don't intervene immediately, the risk of overdose or sudden medical deterioration is terrifyingly high.
And that brings us to Section 3, the healthcare workforce crisis, dealing with staffing shortages and system strain.
This isn't just a case of, bad facility management. It's actually a direct reflection of a statewide emergency. In 2026, the broader healthcare workforce shortage in New York was so incredibly severe, it literally prompted a state disaster emergency extension. Think about it. If standard, well-funded hospitals are struggling to find enough nurses and doctors right now, imagine how ridiculously tough it is to recruit specialized clinical staff to work inside a secure, high-stress correctional facility.
The real-world impact here is pretty alarming. You can have the absolute best healthcare policies on paper, but that means exactly nothing if there's no one around to actually execute them. Being short-staffed sets off this dangerous domino effect. Basic sick call visits get delayed, crucial suicide prevention protocols slow down, and facilities are forced into the logistical nightmare of dragging inmates out to outside hospitals. Plus, all that high staff turnover just completely shatters any continuity for long-term treatment plans.
Let's look at Section 4 now, the price of failed oversight, focusing on accountability and patient safety.
Now, New York does have a heavily layered oversight structure with multiple agencies keeping watch. But even with watchdogs on duty, the system can, and does, fail. That abstract idea of vendor oversight became shockingly real during a massive 2026 settlement by the Attorney General. They investigated two entities, NAFCare and Proactive Healthcare Medicine, for something deeply serious, the illegal practice of medicine within the state.
The timeline here is just tragic. Between 2021 and 2025, there were 3 separate deaths in custody at the Onondaga County Justice Center. That naturally triggered a 2026 Attorney General investigation. And what they found was that the company was broadly controlling medical decisions without actually being licensed to do so in New York. The fallout? a massive financial settlement, and a 5-year ban from operating in any New York correctional facility. It's a pretty stark reminder that licensing isn't just bureaucratic red tape, it is quite literally life and death.
Which leads us to Section 5, the aging prison population, which acts as a major multiplier on all these systemic pressures.
The actual demographics behind bars are fundamentally shifting right now. That 2026 Comptroller report highlights a huge jump in the share of older people in New York prisons. So we're not just talking about basic first aid or standard checkups anymore. We're dealing with complex chronic disease management, specialized mobility support for folks relying on walkers or wheelchairs, and honestly, frequent hospital-level care. This demographic shift is acting like a massive cost multiplier across the whole system.
Finally, Section 6, building a better system by taking a public health approach.
State agencies are pointing toward what they call a continuity-based approach to fix these glaring gaps. It starts day one with incredibly strong intake screening, spotting medical, mental, and substance needs right out of the gate. Next up, you need rock-solid medication continuity. Vital psychiatric and addiction treatments just cannot be interrupted during a stay. And lastly, comprehensive discharge planning. We can't just release people out onto the streets. Follow-up care has to be arranged the exact moment they leave custody. It's really about treating incarceration as a time where care is actually intensified, not paused.
But for true lasting reform, we need more than just baseline medical care. We need a complete systemic overhaul. Recent state reporting really hammers home the need for serious staffing stability and crystal-clear emergency response protocols for crises. And crucially, it demands unyielding, totally transparent oversight of private contractors. Accountability bodies like the Commission of Corrections Medical Review Board that investigates in-custody deaths are absolutely essential. We have to learn from past tragedies to prevent avoidable harm moving forward.
The reality today is that the lines between the justice system and the healthcare system have pretty much completely blurred. Jails and prisons are managing complex chronic illnesses and severe mental health crises every single day. So I want to leave you with this final provocative thought. If incarceration is genuinely a public health issue, are our jails truly equipped to be our largest hospitals? It's a massive, massive responsibility, and it absolutely demands our full attention. Thanks for joining me on this explainer.